Do you have an exhilarating job? Would you like one? My name is Sherry McAllister, and today I'm going to talk with you about a field that has many opportunities for service to others. The medical field has many paths that you may go down, but today I want to talk to you specifically about medical office administration. Now, this will not make you a doctor or a nurse, both of which are extremely important. However, it does give you opportunities to serve others in a very important and rewarding way. We are going to talk about some of the responsibilities and some of the trials you may face, and also some of the satisfactions that this career path will give to you. There are many levels of positions within the medical office field. Entry levels such as receptionist, and then you have office assistant, office manager, records officer, unit secretary, executive assistant. Skill levels build as you move up within this career field. For an example, receptionists would answer the phones, take messages, greet patients and their family members, and welcome visitors to facilities and direct them to the different locations within that facility. And the office assistant would need those skills, as well as being responsible for filing charts, filing insurance forms, getting insurance prior approvals if it is required by the patient's insurance company. They would collect money and schedule hospitalization, tests, and labs. Now, the office manager would need all of those skills and would make sure that the office ran smoothly on a daily basis. Also, the office manager would handle conflict resolution within the office and with the public. They would handle payroll, tax document preparation, which normally go to a CPA, and they would make sure that the office inventory stays well stocked. They would need to be current on HIPAA regulations, VA programs, Medicaid, Medicare programs, insurance regulations, and there would be times when they would have to work with attorneys in incidents where there were accidents and medical bills were accrued and it's in litigation, or when a person is deceased and there are outstanding medical bills. Now, these three positions you can normally find in large and small facilities. However, the unit secretary, records officer, and executive assistant are normally found in larger facilities like hospitals and outpatient care facilities. The records officer would be in charge of keeping charts filed properly according to name and inactive or active status, and making sure that they're kept confidential. Unit secretary is similar to an office assistant, but it is focused on an individual unit, such as an intensive care unit, critical care unit, or within a particular floor of a hospital. The executive assistant would need all of these skills and would work with the executive branch of the hospital. They would be responsible for making flight, hotel, and dinner reservations for the executives, as well as incoming guests when requested. They would keep itineraries and may sit in on conference calls and would be responsible for taking notes of those meetings. Normally, this position does not interact with the patients or the family members. Now, I want to share a couple of stories with you really quickly. I recently interviewed Mrs. Jill Watkins Carden. She is a financial officer for 10 individual physicians' offices here in Wayne County. She told me that when she started 13 years ago in this field, she started as part-time as an emergency room registrar. That's the one that takes your personal information, your insurance information, and gives you the ID band. She said that sometimes she could not get the information up front and she'd have to go into the room in the emergency department. Once when she walked in, there was a man that had part of his brain protruding from his skull and blood was everywhere. Another time she went back there and a patient was vomiting. And she had to run out of the room because she began vomiting too. So you never know what circumstance you may be put in or what you run into, but you must retrieve the information and get the job done. Now let's talk money for a moment. Because as rewarding as service is, we all have bills and we would all love to give our families a comfortable lifestyle. Medical office pay scale varies just as much as there are positions. The Bureau of Labor Statistics said that the average medical office assistant can earn between $22,000 for an entry-level position to as high as $100,000 for a late career position. Now, I was curious to see which facility paid the most wages and if the region of the country made a difference. So I looked into this further. Region does make a difference, and it varies from city to city. According to payscale.com, a medical secretary in Fresno, California makes $38,297. But in Daly City, California, they make $47,441. In El Paso, Texas, $33,476. But in Houston, Texas, $38,719. New York City, $45,949. In Sioux City, Iowa, $31,831. And right here in Raleigh, North Carolina, $36,728. And yes, facility impacts salary as well. So if you look at our chart, it's based on facilities. Did you notice which one paid the highest? I always thought that a hospital would be the highest wage payer in the medical field. But this says a dentist. A dentist. I was shocked. Were you expecting that? Now, all of us are aware of how much satisfaction we can derive from giving our family a comfortable lifestyle. But let's think about other satisfactions that we can get, like helping someone understand confusing documents or procedures, understanding programs and getting into programs that can help them get the necessary medical treatment for their health situation, or just listening and handing a tissue and giving a comforting word to someone sitting in your office sobbing. And then, what about at the end of the day, the feeling you get when you had a mountain of work to get done and you've got it all accomplished? Then we can help future generations by sharing our knowledge, training them, teaching them new skills. As baby boomers continue to grow older and the population continues to grow bigger, there will be more opportunity for more facilities because the need will become greater. More facilities mean more positions in the medical office administration field. So if you feel that this is a good fit for you, call Wayne Community College at 919-735-5151 and talk to a counselor and let them help you get started on a very rewarding journey. Are there any questions? I would like to thank you for allowing me to speak with you today about the medical office administration field.